My name is Sarah Paul, and I'm a nurse practitioner in the Doctor of Nursing Practice program at the Duke University School of Nursing. I'd like to speak to you today about hospice and palliative care. Palliative care and hospice aim to relieve suffering and improve the quality of life for patients with advanced disease and their families without implementing aggressive curative treatments. Federal legislation in the United States created the Medicare Hospice Bill in 1983, which also incorporates palliative care. In 1997, the Balanced Budget Act provided that Medicare coverage for hospice was unlimited, but the patient must be deemed terminally ill with 6 months or less of life expectancy. Hospice Medicare benefits provide for prescription medications to relieve pain and other symptoms, medical supplies and appliances for home care needs, and caregiving personnel such as nurses and home health aides. Social worker and bereavement counselors are also included in the benefits. Considered to be the model for high-quality care for terminally ill patients, hospice focuses on comfort and caring, not curing, and in most cases is provided in the patient's home. More than 1.3 million dying Americans received care from the nation's hospice providers last year, a number that continues to rise. From 2001 to 2003, the number of hospital-based palliative medicine programs has grown by more than 60%. It's clear that hospice and palliative care fulfill a need. Yet the Centers for Medicare and Medicaid Services passed a rule during the Bush administration that would cut Medicare reimbursement rates for hospice and would irreparably damage hospice programs across the country. If implemented, such a reduction would cut hospice reimbursement by almost $2.2 billion, with a B. The rule is an effort by CMS to reduce hospice payments by regulation, but it does so with virtually no data to back up its push to cut hospice care to the terminally ill. In September 2008, the National Hospice and Palliative Care Organization filed a lawsuit to stop this rule. They say that research has shown that hospice saves the Medicare system money. According to an independent 2007 Duke University study, hospice saves Medicare an average of $2,300 per patient, amounting to a total savings of about $2 billion a year. Research has also shown that hospice care is highly rated by family members of hospice patients, and it enables the patient to die at home in most cases. Fortunately, in February, President Obama signed a bill into law that includes a one-year moratorium on cuts in Medicare funding for hospice programs nationwide. The phased funding cut would have taken $135 million away from quality and compassionate end-of-life care in fiscal year 2009. If allowed to move forward in fiscal year 10, this misguided rule will slash hospice payments by approximately $2.18 billion in the first 5 years, despite the fact that hospice has been found to be a cost saver for the Medicare program. So how much funding is directed toward research to demonstrate the benefits of hospice and palliative care? A recent study published in the Journal of Palliative Medicine identified 388 original palliative medicine research manuscripts published from 2003 to 2005. 279 papers, or 71% of them, received some extramural funding. 122, which is about 31%, were from the NIH. The other studies were funded from the VA, the military, foundations, and industry. The study showed that over 25% of published palliative medicine research was performed without any extramural funding, and less than 1/3 of the published studies were supported by NIH funding. Federal funding for palliative and hospice research remains low. The institutes of the NIH are disease-specific, and although palliative medicine applies to many serious illnesses, it does not fit within the specific scope of any particular institute. Consequently, research in this area is often overlooked. Research is needed to supply data that hospice and palliative care provide a valuable and cost-saving service to the citizens of our country who are at the end of life. NIH funding available for palliative medicine research needs to be increased, and concrete strategies to promote palliative medicine research needs to be undertaken. Dedicated research funds for palliative medicine should be established under each NIH institute whose scope encompasses patients with serious and life-threatening illness. This approach has been undertaken in Canada, and has resulted in a dramatic increase in the number of palliative medicine applications submitted and a corresponding increase in the funded palliative medicine research projects. Palliative care and hospice relieve suffering and improve the quality of life for patients with advanced disease and their families. One such patient is Polly, an 84-year-old woman with end-stage heart failure. Because Polly is able to remain at home with her daughter and her family, Polly has enjoyed the company of her 5-year-old great-grandson, Luke. Polly and Luke read together, they watch TV together, and they are fast friends. These are days that Polly's family will cherish forever. Several trips to the hospital have been avoided because Polly is under the care of a hospice nurse, and she has the support of the hospice program that allows her to remain in the comfort of her home. I'm here with Polly, and she is a patient who has had hospice now for how long have you had hospice visiting you?
A year.
A year. And your nurse comes how often to see you?
Once a week.
Once a week. And what are some of the things that hospice has provided for you?
Oh my goodness. Peace of mind for one thing. They have a nurse that comes out, I tell you, once a week. And he takes my blood pressure, checks my lungs, checks my heart, and what else?
Hospice, what about your medications? Did they help provide your medications?
Yes, they do.
What are some of the things that hospice has provided to make your home more accessible for you to live here?
They provided my wheelchair, the chair in the bathroom that I can sit down on. What else?
To take a shower.
Yes, to take a shower. Just things that I can do on my own that I couldn't do without them, you know.
Tell me about how hospice has been helpful to you as Polly's daughter to help her, to help take care of her here at home.
Well, hospice has been here with us for a year, and during that year we've had numerous episodes that I would have been really uncomfortable with and a little frightened had I not known that I had 24-hour access to nurses that I could ask questions of. And the very first time they came and I found out that they were going to come, I said, you know, I feel a burden has been lifted off of me. I have a backup plan. I have somebody to ask the questions of because I'm not a medical person. We can talk about medicine. She gained 3 pounds overnight. Do I increase her Lasix for today? And that sort of thing. And we can make medical adjustments and we can just make me feel more comfortable too. And so would you otherwise be taking her in for doctor appointments? I mean, how would that be? I would have to take her in, and it's very difficult to move her because she's so fragile. Her skin bruises easily and she gets skin tears. She's not very mobile. We would have to go to the doctor. We've probably hospital visits, maybe 5 of those have been avoided in the past year where I probably would have had to have transport via ambulance. Just to get her there, and we've avoided that altogether. Just a phone call to the nurse if it's not their day to come, and they come anyway and check her out, and we don't have to go to the doctor. She's had pneumonia 3 times. We haven't had to be hospitalized because we caught it early and we got the medication and she was able to stay here. And that also avoids other infections and things that she could get while hospitalized because she is frail.
I get to stay home with me and Lucas and Paul because hospice comes out and takes care of me. They're nice people. They probably saved Medicare tons of money because I don't have to call an ambulance every time I need some help, you know.
She broke her ankle right here one time, and she broke a lot of times, and she's old, and if you pull on her really hard or punch her really hard, she'll break because she's really old.
This is a beautiful book, isn't it? What is that?
Oh, there you go. That's so
I
nice.
love you.